One of the keys to practice growth is treatment acceptance. Stay tuned, we're going to talk about my keys to getting your treatment accepted every time. If you are a woman who is a dentist and you are looking for actionable content to build your practice, to get more new patients, to enjoy work more, subscribe to this channel. I'm going to post videos every Tuesday giving you something that you can take action on right away to build your perfect practice. When I realized that my treatment acceptance rate was garbage, I'm talking below 50%, I knew that I had to do something about it. I was working hard on bringing patients in the door, and then I realized that was a waste of my energy because we weren't keeping the patients that we were bringing in the door. Now I've got my treatment acceptance rate up to 80% or higher almost every single month. So stay tuned, let's talk about the keys and how you can get there too. The most important thing when presenting treatment to a patient is make sure you have enough time. You cannot be rushed in doing this. Now, time can be important from the doctor's standpoint or from a treatment coordinator or a role that you might have in place in your office where someone else does the majority of the treatment presentation, but you must have enough time. I think that it is incredibly important that the patient feel heard and that you have time to answer any and all questions that they might have. If you are rushed, then what usually happens is you need this is why, like, super brief. They don't feel like they have an opportunity to have an actual conversation with you about the treatment that you're presenting. We have something called informed consent for a reason in dentistry, and you need to have time to present all possible options, all benefits, all potential consequences, and answer any questions that come along. Your patients will thank you for this. And we get comments all the time in the office about how no one ever feels rushed. They don't feel like a number, they feel like we care, and you want that too. Number 2, education. This is a passion of mine. I spend an incredible amount of time myself, or my treatment coordinator does, educating our patients and their families about what we want to do and why we want to do it. If you do a great job of your education up front, you will have fewer questions. This is awesome too, because you'll learn over time what the biggest questions are or the biggest objections. So when you're doing your education about your treatment plan, you can give that information as you are explaining. This is helpful. A confused mind will never buy. So you have to make sure that they really do understand and not that they're just saying yes. People don't like to ask questions if they think it may make them look unintelligent or confused. They don't want to feel embarrassed in front of the doctor. So you have to make sure that you're taking the initiative to do that education. It is unlikely that patients will just take your word for it, especially if they're brand new to you. So if you sit down and take the time to educate, use some visual tools as well, you're going to start building some rapport and some trust with your patients. And that is super duper important. They need to feel that you care and that they can trust you. And if you're walking them through the process slowly and with a lot of education, you're going to start building that trust. So, how's this resonating with you so far? Do you think those first 2 are possible? Let me know where you're struggling in treatment acceptance or treatment presentation. I would love to do another video for you about specific concerns that you might have. Number 3 is language. I know I've touched briefly on language here. We talked a lot about education, which involves a whole lot of language. But the key to language is do not use dental terminology at all. And it may be difficult for you to figure out where you might be using words that don't make sense to the patient. So you should be speaking to everyone on your team, and everyone should make sure they're using the same words for the same things. Let me give you an example. You could have a dental hygienist that's talking to a patient about getting a deep cleaning. You could have a dentist come in and talk about something periodontal and using that word. You could have someone else talk about scaling. They could all mean the exact same thing, But if the language around the patient is using all of these different words and terminology, that breeds confusion. And then they're not sure who's talking about what and who's going to do what, and if these are all separate things or they all go together. So it is very important that you make sure everyone is using the exact same words for the exact same things consistently with all patients. A word that we realized we were using that was very confusing to patients that I really hadn't even considered was the word eruption. I'm an orthodontist. We talk about teeth erupting into the mouth all of the time. And I hadn't considered that the word eruption could bring to mind something like a volcano, and that word didn't mean to a lot of my patients what it meant to me. And so we talked about it, and now we might use we use words like grown up teeth coming in or new teeth growing in instead of the word eruption. Be careful, because you might think that the words you're using are layman's terms, but we use a whole different language in the dental office, and the patient would not be aware of those words. So this involves everybody. It's critical to having patients not be confused. Another thing on language. You should be listening in your treatment presentation at least as much as you are speaking, and sometimes more. People want to feel like you understand them, you understand their concerns, and you understand what they are looking for. If the vast majority of the treatment presentation is you simply talking and then walking away, they will feel like they were lectured to, and they won't feel like you've heard them. You have to remember that people will buy based on emotion. It is not on logic. So they need to feel like you've heard them, you understand them, and because of that, then they like and trust you. And so that combination is way more likely to lead to a purchase decision now or in the near future. So there are some questions that you can ask to get the patient talking. Some great key ones in a general dental office is to ask what their goals are for their oral health. If they have any big fears or worries about their teeth or gums going forward in life, find out what their motivation for coming to the dentist regularly is, and then you can use those answers to help in your presentation to show them that what treatment you're recommending is in line with the goals that they have. So you're not putting your goals on them, you're taking their goals, their words, and you are helping them to achieve that goal. Okay, number 4, confidence. Now I'm not talking cocky, ego-driven confidence here. I mean, you should feel incredibly confident in what you are recommending, your ability to do it, and the reasons behind doing it. You only want to recommend treatment to your patients that is in their best interest. Now that also means that you should be recommending all treatment to all patients, regardless of how you have judged them in your initial meeting with them. When I say judgment, I do mean judgment. The human brain will always judge another human being on initial interaction. And just being aware that you are judging people is helpful, and you can take a step back and realize that your judgment is usually incorrect. So if you're thinking they can't afford a crown, or they're not going to come back for their next appointment, or this will be the only time I will see them, or any number of judgments you could possibly make, drop that. Your presentation to your patient should always be based on what is best for that patient. Patients do not know what is possible in dentistry, they do not know what you are capable of, and they do not know what is best for them. Once you have their goals and their values for their oral health care, then you can use the language that resonates with them and present everything that you think is in their best interest for them to accomplish their goals. That plan may be different. If someone says, I really don't care, I'm going to lose all of my teeth and I want dentures, you may be presenting some very different treatment than someone who is scared of losing teeth and wants to keep their teeth for their entire life. But when you know what they want, and you've dropped all judgment of what they can or cannot afford, or what they are willing or not willing to do, then you can put forth what is in the absolute best interest of that patient. When all of these things are followed in sequence, people are going to feel heard, they're going to like you, They're going to trust you, and you are going to be speaking in words that they understand, talking about their goals for their oral health. It's far more likely that they are going to accept treatment. Now, that doesn't mean that if you presented a $10,000 or $15,000 treatment plan that they're going to, be super excited and jump on board and get everything done right away. But if you've done it in this way and they do trust you, that's going to stay up here. And eventually, over their relationship with you, they will make those purchases, especially if that trust and rapport gets built at every single appointment when you see them. By simply changing the way that I was interacting with my patients, our acceptance rate of treatment went through the roof and has stayed ever since. And these basic principles are what has made a huge difference in my practice. Now that you've knocked their socks off with your treatment presentation, you're going to want to make sure that you keep building that relationship and that your practice continues to grow and thrive. Make sure you subscribe to this channel and go to my website and check out all of my bite-sized affordable courses for dentists, women, all of you out there, to make sure that you can build your perfect practice. I am here to help you build the practice of your dreams. Please comment down on this video, like this video, share with anyone who you think might be interested in some tips to help their practice grow. I look forward to seeing you next week. Bye-bye.